First of all, I just wanted to thank you for joining us this evening for our third All-City Town Hall. My name is Leslie Arroyo, and I'm the Communications Director for the City of South San Francisco. I will be the moderator for tonight's Town Hall, and for those of you who have joined us in the past, you've heard this before, but I just wanted to first describe how the meeting will go. And first off, we do have the lines for folks who have called in. They're muted, and that's just to kind of prevent people talking over each other, and because we have so many people calling in. So we have people that have sent in the questions ahead of time for this town hall, so we'll answer those questions this evening. But if you have a question tonight while we're having this town hall, there's 3 ways that you can reach out. You can email us, and that's cityinfo@ssf.net. And you can email us during this call, and we'll address your call or your question. You can also send us a text at 650-636-6668. And if you happen to be joining this call through your computer, there's a chat function. And you can go ahead and submit a question that way, and we will address it. So if after this call a question does come up, please don't hesitate to email us. Again, the email is cityinfo@ssf.net. And we will respond to your email. And then all of the questions from tonight, as well as this audio recording, will be posted on our website, and that's ssf.net/coronavirus. So tonight's town hall once again features our mayor, Rich Garbarino, who's going to have a few words to say to you. Also joining us is our police chief, Jeff Azzapardi, and our fire chief, Jess. In addition, we have our city manager, Mike Futrell, who will give us an update from the last time we held our town hall regarding the coronavirus. And lastly, we've got Dr. Brian Sloan, and he has joined us in the past. He's a doctor with Stanford and is also with the San Mateo County Emergency Medical Services. And he'll speak to us just from the perspective of the county side, as well as he's available to answer any of your health-related questions. So with that, I'd like to invite our mayor, Rich Garbarino, to say a few words. Rich?
Thank you, Leslie. Good evening. This is Mayor Rich Garbarino, and thank you all for joining us this evening for another virtual city town hall. I know for many these are trying times, and it can be wearing on all of us, but I want to ask you tonight to be part of the solution and not the problem. This is especially important as California slowly begins to open back up. Many are breathing a sigh of relief, but know that this is still far from over. I know that there is fatigue of social distancing and wearing your face mask when out in public, but I can't stress enough that the safest thing anyone can do in the middle of the COVID-19 outbreak is still the same as it was a few months ago. Stay home as much as possible to avoid catching or spreading the virus until we get a vaccine or effective treatment, or until the pandemic otherwise ends. That especially applies to people who are sick, who should do all they can to avoid exposing others to the coronavirus. Excuse me. There's one item that I would like to address tonight, and that's a rumor that is circulating on social media and between some of the seniors who utilize Magnolia Center, Senior Center, and the adult care programs. The programs that operate out of Magnolia Center are currently closed due to the county health officer's shelter-in-place order. The building and group programs that operate out of this facility cannot reopen until the shelter-in-place order is amended to permit group activities for seniors who are, as we know, are at the highest risk for serious outcomes if they contract COVID-19 and must be protected. Let me just emphasize, especially I just got an email from Denny, there is no plan to permanently close Magnolia Center or terminate programs for seniors or to repurpose the building for some other use. Any savings that can be captured during the closure will be identified and put towards balancing the budget. You know, remember, rumors, misinformation, speculation only serve to increase public angst. When the order is lifted, the city intends to restore senior programming at Magnolia. In the meantime, Senior Center staff have been working very hard to continue to safely provide services to our seniors. These efforts include making daily telephone welfare checks and answering phone and email inquiries. creating a printed and online senior newsletter, which identifies many useful resources, creating and delivering activity kits, and pivoting from regular programming towards addressing food insecurity issues, including making food deliveries to qualifying homebound seniors in need. Staff are also working with the county to modify operations, such as working with smaller groups and utilizing strict social distancing protocols to be prepared to provide safe programs as the shelter in place is relaxed. I encourage residents who would like more information about any of the services mentioned to call the senior supervisor at 650-829-3822. I hope what I've said helps clarify things. Again, I want to thank you all for joining us this evening. And now I'd like to turn this back over to Leslie. Leslie?
Okay, thanks, Rich, and we appreciate that. Now go ahead and repeat that phone number again if you have questions about the services mentioned, to call the senior supervisor, and that number is 650-829-3822. Now I'd like to introduce our police chief, Jeff Azzopardi, to say a few words. Jeff.
Leslie, can you hear me okay?
I can. Thanks, Jeff.
Okay. So good evening, everybody. Jeff Azzopardi, your police chief. And I just want to start off by saying thank you to everyone for the support that they've given to the police department, our first responders, and our entire city staff throughout this process. It's been difficult for everyone. We know that, and I'm glad everybody's coming together. I would like to tell everyone heading into Memorial Weekend, this is oftentimes a very busy weekend for us. A lot of people are out and about, and obviously I think that's going to be different this year with the order, and I'm hoping it's different this year. And I want to ask our South City residents to please continue to follow the order, stay in as much as you can when you're not out getting essential services or out getting exercise. Try to stay home. As a whole, I think our residents are doing a great job following the order. We are getting some calls of some people that are violating it, and we're still trying to really spend the time educating those that are violating it, because we really don't want to enforce the order if we don't have to, but we absolutely will if we need to. We're still operating on the education piece. We're still trying to give warnings, and we really don't want to cite people if we don't have to. I'm just want everyone to know that as a whole, as a community, South San Francisco is doing great. And the police department, fully staffed at the patrol level, is ready for this weekend, is ready to continue serving and protecting our residents here in South San Francisco. I ask you and applaud you for your continued support of our city, of our police department, and of our county in this order. And please stay safe, stay inside when you can, and we just want everyone to be safe, and as we hopefully can get through this in the next couple months. So thank you very much, everyone. Once again, if you have any questions or if you need to contact anybody at the police department, please feel free to call us. Our non-emergency line, 650-877-8900. Specifically, if you want to report maybe a possible violation, we ask that you not use the 911 line unless it's emergency. Thank you very much, and have a happy and healthy and safe Memorial Day weekend.
Great. Thanks so much, Jeff. We really appreciate it. Now I'd like to turn it over to our fire chief, Jess Magallanes. Jess.
Good evening. Can you hear me, Leslie?
I can. Thanks, Jess.
Okay. All right. Well, I wanted to kind of echo what the police chief said and thank everybody for all of their support and kindness that they've shown our department and the rest of city staff as well. I also wanted to give you some updates on just how the department is doing. So, first off, fortunately, our department has not had any employees test positive for COVID. Our call volume is holding. It's slightly down a little bit, but our EMS calls are up. We do have all of the PPE necessary. Our supplies are maintaining, and we have an adequate amount for the current rate of usage that we're having. So I know that people have been hearing that there's concerns with PPE. Our department has a full supply of PPE right now. All of our apparatus and equipment are being fully staffed. We're running 3 ambulances daily. And wanted to take this time to share something that we're excited about. We just received 2 new engines that had been being built for over the last year, and so we're really excited about that. And I wanted to thank council and the community for their support again with that. Like everyone else, we're taking all the precautions of maintaining social distancing in the station and out on calls. We're disinfecting daily our equipment, our apparatus, our stations in the morning, and even before we prepare meals. We're doing daily temperature checks to make sure our folks are staying healthy, and we're continuing to stay diligent and practice all the safety measures to minimize any exposure and stay available for emergency response so that we can serve our community. So thank you for doing the same. Please keep up the good work. And as Jeff said, have a healthy and happy Memorial Day weekend.
Great. Thanks so much, Jess. We appreciate that. And now I'd like to turn it over to our city manager, Mike Futrell, for some more information. Mike.
There we go. Hello, everyone. We are still in shelter in place. So let's go over a few things and update you on that. In the beginning, the shelter in place was pretty easy. Everybody stay home, period. Everything's closed. You can go to the grocery store, etc. It's gotten a lot more complex. We have a new shelter in place order that took effect on Monday. It has no end date. That's something new. The others had a from date and a to date. This one does not. It just continues on until the health officer changes it. So that's number one. Number two, it still maintains the basic rule, which is stay home. So that is the best advice, and stay with your family, stay safe. But it has a long list of exceptions now as we start to gradually reopen San Mateo County and our society. So we've always been able to go to the grocery store and the hardware store, but now retail stores can open, but no one can go inside. So you can call, you can go pick something up at a retail store, they can deliver it to you. Offices can open unless someone can effectively do their job from home. All construction has restarted. Outdoor activities like gardening, landscaping companies, they're back to work, as well as businesses which are normally outdoors, such as golf courses. So you're going to see over the next few months gradual loosening of the shelter in place, but you should expect we'll be under some sort of shelter in place through the end of the calendar year, through the end of December. Things like large gatherings, not sure we'll be able to do those by the end of the year until there's a vaccine or an effective treatment. Things like large luncheons, we're looking at a movie night in the park is not going to happen this summer because of the crowds that might attract. So, but know that we are slowly getting back to work. Childcare is now allowed, and we in the city are looking to reopen our summer camps and pre-K programs by June the 15th. So I want to thank those staff members working hard to make that happen and make it happen safely. So, but the base rule still remains, stay at home if you can, wear a mask when you're out in public, wash your hands, and by all means, maintain that social distancing. You know, all of this is causing a great deal of stress, both health stress, but economic stress as well, as over 36 million Americans are now unemployed, an incredible amount. And food security is one of the issues that we are seeing more and more every day. And every day, city staff, along with volunteers and Meals on Wheels, we were out in South San Francisco delivering meals to those in need. And every 2 weeks, we have a food distribution, and whoever shows up until we run out of food, and that is tomorrow. So tomorrow, beginning at 10 a.m. at Hillside Montessori School, so it's right off Sister Cities, we will be distributing food. And what you would get, you drive up, we won't let you get out of your car, and you'll get a box of fresh vegetables, a box of dry goods, and then a frozen chicken. So this will be the 4th food distribution that we have had, and we plan to have them every 2 weeks through the end of June, possibly longer. We'll see how it goes. But the last one, for example, we've provided food to nearly 800 families. That's how intense it is going. And there are distributions in Daly City and Redwood City as people are just struggling to get by. We also have a program to help people pay their rent, and that's a struggle. Right now, there is still a moratorium on evictions. No one can get evicted. So if you've lost your job, that's one less thing to worry about, but you will have to eventually pay your rent. So if you're struggling with paying your rent, contact the YMCA here locally in South San Francisco. They are the service provider for these type of activities for our city. The City Council has provided $250,000 to the YMCA to administer on behalf of South San Francisco residents in need to assist with that sort of thing. So by all means, please contact them. And by the way, all of this is available on our website, ssf.net. That is such a wonderful resource. It's updated every day. All this information that is flooding into you, we try to distill it, make it easy to understand, and put it on that website. So if you're struggling with rent, contact the YMCA in South San Francisco. The City Council has also provided money for a small business loan program, which is kicked off to help our local businesses. Our local businesses are struggling, as you might imagine. So to the extent you can, please patronize those businesses. We have restaurants that are open for takeout or delivery. We now have retail stores that are opening back up, as I mentioned. Pay attention and help those local businesses. But the City Council did provide $640,000 in a grant program, loan/grant program for those businesses to try to help them survive. Nationally, I've heard numbers as high as 40% of all businesses will go out of business. We don't want that in South San Francisco. We're going to try hard. Many of these people are our neighbors. We've known them for decades, and we're working hard to try to make that happen. So stay safe. I'll be available throughout the call for any questions that might happen. Know that your city government is pretty much back to work. Last Wednesday, so just a little over a week ago, both Park and Rec staff and Public Works staff reported back to work 100% for the first time as we began to catch up on all the maintenance in the city that we understandably had to forego during the beginning stages of the coronavirus. So thank you to those workers who are taking the appropriate precautions, one person per vehicle, wearing a mask, having the right PPE, but back to the business of making sure that our storm drains operate, our streets are maintained, and that our parks are clean and maintained as well. So gradually it's beginning to come off, but please don't become complacent. We do not have a vaccine. We do not have an effective treatment yet. So we're all in this together. As long as we exercise proper precautions, I think we'll be fine. So Leslie, back to you, but I will hang around for any questions that we might have.
Okay, great. Thanks so much, Mike. And then our last speaker that we have on the phone and on our webinar is Dr. Brian Sloan, and he's joining us again tonight, and he's here to give us an overall county perspective. And after Dr. Sloan is done giving that update, we'll dive into some of the questions we've received, and then also take some questions for folks that have joined us tonight. So Dr. Sloan, are you on the line?
Hi there, Leslie. Thank you again for having me tonight. It's a pleasure and an honor to be included in these town hall meetings. I'd like to say first and foremost a very heartfelt thank you to the citizens of South San Francisco and all of San Mateo County. I have been so incredibly impressed by the vigor at which the stay-at-home orders as well as the face covering orders have been followed. Every time I leave my house or go to work, I am absolutely thrilled with the amount of people I see wearing masks when they're out, people respecting social distancing limitations in grocery stores and public places. It really is making a difference, and it really does show. And on that note, we continue to have good news in our county that our numbers are just not as severe as they could have been. This shows that our social distancing measures, all of the sacrifice that everyone has been making has paid off, and it has paid off dramatically. So far in our county, we have only had 1,738 people test positive. Of those people, we've only had 75 deaths. Now, of course, all of those deaths are terrible tragedies, but those numbers are still significantly lower than our initial predictions that didn't account for social distancing. So we're doing much, much, much better than we could have without putting these measures in place. We currently have 71 COVID positive patients that are hospitalized. And overall, when we look at our county public health testing, we've had about a 7.2% positive rate on all tests that are done and run at the county lab. So far in the city of South San Francisco, we've had 157 positive cases, which is in the grand scheme of the overall amount of citizens we have in South San Francisco is still quite a low number. So we're doing very, very, very well in terms of how we're controlling the virus's spread in our community. On that note, there is all of this data as well as much more that can be found on the San Mateo Public Health website, which is smchealth.org. Again, that's smchealth.org. There's an excellent dashboard there that shows a current count of the number of cases in the county, as well as the amount of patients that are hospitalized in the county and the amount of those patients that are hospitalized in the intensive care unit. It's an excellent resource that is very easy to digest and very easy to read, that I look at myself daily, and I recommend people look at as well, just to kind of get an overall idea of the general direction we're heading in the county. Now, that being said, our county has done, in my mind, of course, I may be slightly biased, but I think our county has done an excellent job in responding to this crisis. We've been working with all of our local partners, all of our EMS services, fire departments, and police departments to make sure there's an adequate supply of PPE. And that initially was a major challenge, but we seem to have, met that challenge and exceeded the limitations that we had initially. We've also worked very closely with all the local hospitals and have had both state and federal resources, as well as some volunteer resources, come to our community to be able to help us with alternative care sites, as well as other programs that we have to make sure that we're able to meet this need. So far, we have not experienced any of our hospital systems being overloaded, so very, very, very much good news on that front. Now, with that good news also does come some bad news. We have seen an increase, not necessarily in our area, but across the world and the rest of the country, in the amount of cases that are affecting pediatric patients and young adults, and the amount of post-infection complications that we're encountering. For example, there seems to be an uptick of the amount of young people without medical problems that are having strokes that may or may not be related to recent COVID infection, as well as an increase in a multi-system inflammatory disease in children that's somewhat similar to what's known as Kawasaki's disease that we're just starting to see pop up and become more prevalent. Now, we don't know what this means. We do know that obviously this is a problem. Anytime that there is a complication after infection, that's more health problems for someone to deal with, but we don't yet know the specific implications of these problems, and that's something that we're trying to determine as a scientific community as this pandemic progresses. With all that being said, we're still doing very well on the West Coast and in the Northern California area in particular in responding to this virus and with our overall disease burden. So as we start to open back up, please, please, please use caution. Follow the social distancing recommendations as much as possible, because all we can do is make things worse for ourselves if we are too quick to go back to normal. So with a slow return back to normality, we'll continue to have these same levels of control of infection and be able to keep everyone safe.
All right. Thank you. That's such a great reminder. It's going to be a slow haul, but we'll get through it. And I did want to repeat that website that you had mentioned. It is smchealth.org, and it really does have a lot of information. It does break down by city. It breaks down by gender and demographics. So there's a lot of detail on that information on that website that you can get regarding what's going on from a county perspective. So thank you again, Dr. Sloan, and we're going to keep you on to answer some questions. So we're going to go ahead and jump into the questions. And I just want to remind folks that if you do have a question tonight, there are 3 ways that you can reach us. You can email us at cityinfo@sss.net during this call, and we will address it. You can also send a text to 650-636-6668. And if you happen to be joining this call on your computer, there is a chat function. So you can go ahead and submit a question that way, and we will address it as well. So that being said, I'm going to go ahead. We did receive some questions ahead of time from folks who emailed us at cityinfo@ssf.net. And the first one, I'm going to throw this one to Dr. Sloan, and this person says, I have a 6-year-old daughter, and with recent news about children having a mysterious inflammatory syndrome related to COVID-19, how safe do you think it is for kids to return to daycares and schools before a vaccine is available?
So, Leslie, I think that's an excellent question, and I think I don't have a perfect answer for it. Part of this is going to be how prevalent the virus is. In our area, we've done a good job of controlling it, but there is no way to be completely safe from this virus other than being completely isolated in your own home. We're doing everything we can as a county and as a public health department to make sure that we are quick to address outbreaks and quick to change recommendations if the virus starts to come back or show that it's spreading in an uncontrolled manner in the community. We will absolutely change recommendations about school and daycare should there be a major outbreak or any signs that the virus is starting to get out of our control. That being said, there unfortunately isn't a really great answer I have about how to guarantee that your child is 100% safe if they return to school. And that's not just applying to your child, that applies to you and your family members. We don't have that measure of perfect safety yet. We're doing the best we can with the information that we can and trying to balance not only the effects of the virus on our health and on our healthcare system, but also on the economy. So it's a difficult balancing act, and I can tell you we're doing the best we can, but there's not a great answer now.
Okay, thank you for that. Another question that came in ahead of time, and we'll give this to our city manager. The school district is considering remote learning in the fall. This will impact parents who cannot work from home. What are your thoughts?
My thoughts are that will impact parents who cannot work from home. So we do work very closely with our school system. I know that they are dealing with this, as are we, and I don't believe a decision has been made yet. But there's no question that it will impact parents if their school-age children in the fall are unable to go to school and they're still distance learning. So I don't have a better answer for that, except we are working with the school system. What I'd recommend is that you make your thoughts known to our school board members and to our school superintendent so that they are well aware of the second and third order impacts of such an order. But I'm certain it will be grounded in the health of our children and making sure they are safe. I know we will be operating our pre-K programs in the fall, but they may look very different also. For example, the current order, which allows childcare, says you cannot have more than 12 children per room, and you have to do your best to maintain social distancing, and the staff in with those 12 children cannot move between classes. Well, that alone will probably limit the number of students and number of children that we're able to serve in our pre-K program. So we're working through this day by day, and we are working with the school system. Again, please make your thoughts known to the school board so that they are taken into account.
Okay, great. Thanks, Mike. And then another one for you is a person wrote in, I would like to know why the parking lots near beaches and along the ocean coast are closed. If people disperse on all of the available parking, it will be easier to maintain distance than if the cars are left along the residential streets by beachgoers. Can you explain the reason for this and closing public restrooms everywhere?
Sure, with the beaches I can, for sure, and that was a debate. County has closed those in concert with those cities. So Half Moon Bay, Pacifica. What was happening is the beaches were crowded and people were not obeying the shelter-in-place order on the weekends in particular. So they kept the beaches open but closed the parking lots to discourage people from going to the beach. And again, that was partly at the request of those cities, Half Moon Bay and Pacifica, that were struggling with how do I enforce a shelter-in-place order at the beach on the weekend when we're making it easy for large crowds to go to the beach. So recognize not everything is perfect or logical, but I do believe it has, what I've heard, reduced the number of beachgoers on the weekend, which was the desired outcome. So until we have that shelter in place, they're not going to want a large crowd at parks or the beaches, and closing the parking lots was one way to discourage people from going to the beach. What was
Great,
the
thanks,
part of
Mike.
that? Leslie, I didn't have as
Yeah,
ready.
the second part was just if you could explain the reason for closing public restrooms everywhere.
I know in South San Francisco, we closed the ones in the parks because of health concerns. That one, if you have a public restroom open, we will want to clean it 3 times a day is what we're looking at now. But at the time, it was also for the safety of our own workers. We didn't want people in the parks, generally speaking, and we didn't have the ability to clean restrooms as they should be cleaned after every use to make sure that we're not inadvertently transmitting COVID-19. I think we've all heard the statistics of how long the virus will live on stainless steel, for example. And without those health protocols in place, it was not safe to have the restrooms open. So now that being said, we are moving in that direction, and we will have the staff in place to clean the restrooms frequently. And that's for South San Francisco. I can't speak for the beach communities that I mentioned, but it was all about keeping people healthy.
Okay, thanks, Mike. Another question for you is, when will street sweeping start again?
Soon, I hope. So we have suspended street sweeping. One, for the safety of our people. They were sheltering, the drivers of those vehicles, but also because people are sheltering in place. We really didn't want them to have to go move their cars to make room for the street sweeper. So we suspended the street sweeping. We've also suspended and giving tickets for people who don't move their cars, and we're still not doing that. But we'll be back in the business of street sweeping pretty soon. I mentioned Public Works is now back to work just starting last week. And then we will have to reintroduce the policy, though, if you have to move your car. There's nothing more frustrating than if you don't move your car and we just drive the street sweeper right down the middle of the street. That's not very effective. So please do move your car on the street sweeping day once we get it started, which will be soon.
And we had a follow-up question with regards to the public restrooms that you had just addressed. They were wondering when will the park restrooms be open again?
I don't have an exact date for that, but now that I've, the parks people came back to work last week, and what we can do is put out an announcement and certainly put something on our website, ssf.net, on when that will happen. We must make sure we have the right cleaning protocols in place. If you go into that restroom, you need to have the confidence that it's been cleaned and that there's not something lingering in there that's going to hurt you. And until we can get the staff and the right supplies and the right protocol in place, they need to stay shut. But it won't be long. And Leslie, let's put out an announcement working with Park and Rec on when that date might be.
Sure, sounds good. Okay, we're going to keep you on the hot seat here, and we've got a business located in South San Francisco and are in the process of reopening our preschool. Who do I contact to get signage for social distancing to post at our school?
Well, I think we have some of that, Leslie, in the city. So maybe they could email us at cityinfo.net. And I know we have some signage that we've made up and given out to businesses that talk about mask coverings and social distancing. So I think we can help them with that. So just please contact us. And if we don't have it, we'll steer you in the right direction. But thank you for thinking ahead and posting that signage. It's still very important.
Great, and I agree. One thing too, in addition to emailing, we're happy to give you that information, but we also do have a direct link on our website. So if you go, Mike has mentioned this, ssf.net/coronavirus, and there's some tabs there. And if you see a business recovery tab right there, you will get some links to get, face covering or shelter in place. But again, as Mike said, if you need something else, let us know and email us, and we're happy to help you out. The next question that came in ahead of time was for Dr. Sloan. And you did address this a little bit, and I think you put this into perspective, but somebody said, why does South San Francisco have such a large number of COVID-19 cases, and what can be done to bring this number down?
So that is a really good question. We're not going to be able to bring that number down because that is the number of cases that we have, the number of people who've tested positive so far. So what we can do is slow how fast that number goes up. So by, maintaining our social distancing, making sure that we're wearing our face coverings, making sure that we take all of these precautions very seriously, we can certainly decrease the rate at which that number goes up. And the number of cases in a specific city isn't necessarily reflective of anything about the city, just in the nature of how the virus is transmitted. For example, there was a recent case that was well publicized about a person who went to a very highly attended church service in Butte County. That one person who was actively infected potentially exposed up to 180 people. So in that one specific case, they very well may have a significant, huge amount of number of cases in that area and in those cities, and that's specifically due to one single person going to a large event. So while I don't have a specific anecdote about something like that happening in South San Francisco, the numbers that we see from city to city can be highly variable based on circumstances like that. So, I wouldn't necessarily worry that we're doing something wrong or that there's something abnormal about our citizens or our city, just that these cases can be highly variable based off of even one single individual's behavior.
Okay, great, thank you. Mike, this one's for you. Why does it seem with the economy opening up the rules for social distancing, those seem to be breaking down? How do we put out the message that we are all in this together? And if one person doesn't use a mask or keep social distancing, it puts everyone in harm's way. How do we get everybody on board?
Well, first, they're absolutely correct that it's a very selfish act to not have your mask on and exercise social distancing. You may think you won't get sick, but you might be making others sick and not even realize it. And those people may be vulnerable. You may say, I'm a young person, I'm not going to get sick. Well, it's not about you. It's about what you may do to others. So please, absolutely, wear your mask and maintain social distancing. I think a couple of things have happened. One, the shelter in place order keeps getting amended. We keep opening things up. And I think there's a level of confusion about what is allowed. Am I still required to do this or not? And then secondly, I do think people are pretty tired of all of this, and they're getting complacent and maybe even a little unruly. So as our police chief mentioned, what we are doing is educating. We're not enforcing, we're not arresting people, we're not giving tickets for not wearing a mask, but we will remind people of the rules in place. And through forums like this, through social media, through mailings, and by example, we are trying to keep this enforced as best we can. I'll say it's not just South San Francisco. Occasionally I get to travel to county government or others, and you see it. But I think the root of it is one, confusion, and two, some complacency with having been at this for 2 months and no end in sight. But please emphasize to those you see in a polite way. You can call that number the police chief gave out earlier, and the police will go make an educational call to a business, or if they can, to individuals, and remind them of the rules. But it's something we're going to have to stay on for the next months and beyond, because there's really no end in this.
Great, thanks, Mike. And I'll go ahead and repeat that number that the chief provided. That was 650-877-8900, and that's the non-emergency line. Again, of course, if you have an emergency, please call 911, but otherwise call the non-emergency line. Another question we have is, Mike, I work by myself in the restaurant. cooking, do I need to wear a mask?
Yes, you do. The order specifically calls out those that are in the restaurant trade cooking. They must wear a mask. Now, if you have an office, for example, and you're in your office by yourself, the rule says you do not need to wear a mask, but definitely in food preparation. And if there are restaurateurs listening, one of the keys to having people come back to your restaurant will be you demonstrating that you are following safe practices. So frankly, if there's a restaurant and I know they're not wearing masks when they're cooking their foods, I'm not going to go there, and neither will anyone else. So you are required to do it, but as a good business practice, you should do it.
Okay, and another question that had come in ahead of time was, is there any plan to close Grand Avenue to traffic and let it become the pedestrian way with more room for restaurants to serve customers while maintaining social distancing?
There's not a plan, but there's certainly a study underway that we will bring to council for consideration on June the 10th. Our council is still meeting every 2 weeks. They're meeting virtually like this, so you can dial in. Frankly, it's much easier to attend a council meeting. You can do it from your couch and just watch it on the computer. But on June the 10th, staff will bring forth some ideas in two veins. One, closing streets to allow more space for people to exercise. You've seen cities that are doing that right now. But number two, when restaurants do open, they absolutely will be limited to the number of patrons inside the restaurant. So most of our restaurants are fairly small. And if on top of that you say, I'm sorry, you can only have 2 or 3 tables, not likely that restaurant will survive financially. So the idea of allowing that restaurant to set up outdoor dining adjacent to the restaurant, be it on the sidewalk or in the parking spaces, or even closing a street so they can set up outside dining, is one we will study and bring to council for discussion, not action, but discussion on June the 10th. There will be a time in the near future when they allow restaurants to reopen, and we'd like to be prepared with a plan. And part of that will include how do we expand outdoor dining so that more people can actually get out of their houses and go to a restaurant, but then also provide more capacity for that restaurant so they might survive financially. So we're looking at it. We'll bring it to council on June the 10th.
Okay, great. And now we've got some questions that have come during the town hall here. And again, as a reminder, you can send us through the chat function on your computer, or you can text us 650-636-6668, or you can email us cityinfo@ssf.net. So some of the questions that have come in this evening, the first one, Dr. Sloan, can you talk about your view on herd immunity? Do you think we will reach herd immunity soon, even without a vaccine being available?
I think that's a really good question, and the short answer, unfortunately, is I don't know definitively. Now, herd immunity, for definition, is when enough people in the community have gotten sick from the illness and then recovered and formed some type of immunologic memory of that infection so that they can't get infected again, or have such a mild infection that they aren't too bothered by it, that the illness essentially peters out. Now, we see this happen with many flu variants. We saw it happen with the really bad Spanish influenza that happened in 1918. We don't definitively know if that's going to happen with coronavirus. Now, we think it is. We think if we have enough of the population that gets infected and recovers, that protects the amount of the population that hasn't been infected. Now, unfortunately, the percentage that we have to get to reach that herd immunity steady state is about 60 to 70% of all people being infected. That's an astronomically high number, especially with how severe this virus is. Now, with 60 to 70% of the population being affected, even with less than 1% or 1% death rate for this virus, that's a lot of people who unfortunately are going to pass away before we reach that herd immunity level. So I do like to hope that we'll have a vaccine prior to reaching herd immunity. We have done some studies across the world looking at the prevalence of antibodies to determine how many people in a certain population have already been infected by coronavirus to kind of determine if we're close to that herd immunity. Those studies have some flaws, so I wouldn't necessarily rest my hat on them. That being said, they have shown that we're not even close, and that our best case scenario estimates are that in this area, no more than 4 to 5% of the population has already had the infection. So we're not even close at all to reaching herd immunity. So our best bet right now is to really continue with the social distancing, really minimize the impact of this virus on our community so that we don't have to wait until we hit that herd immunity level, because that is an absolutely brutal level to hit.
Okay, and we'll keep you, Dr. Sloan, with another question here for you. When someone tests positive for COVID, how difficult is it to have an extensive interview if that person's symptoms are severe to see who they have possibly been in contact with?
So what you're talking about is contact tracing, which is a major component of our response to this virus, and one of the major things that we're looking at in terms of going forward. So the goal is, in controlling a pandemic like this, is to be able to do contact tracing for every case. Now that we've been able to control things, we're able to ramp up our response, hire more contact tracers, build more systems so that we're able to follow through more on contact tracing. We're going to be able to do that more. Initially, in the early stages of the pandemic and the infection, not only here, but all across the world, we were so overwhelmed with the amount of cases and severe cases we had that contact tracing just wasn't really a possibility. Now, as things become more under control, as our case numbers decrease, as we're able to ramp up our response, we're going to be able to do more contact tracing. And the goal of that is, when we have someone who tests positive, we talk to them, we find out where they've been, who they've been around, where they work, and we'll be able to reach out to the people that they've been nearby and tell them, hey, you've been probably exposed to coronavirus, please stay home for a while. Make sure you get checked if you start developing symptoms, avoid contact with at-risk populations, and in that regard, be able to decrease the spread of the virus. There also are some new technological interventions that are going to make this easier. I know both Apple and Google are going to be releasing apps as part of new software updates for their phones that will essentially, via Bluetooth, be able to track where someone has been and who they've been near, and give notifications to people that they've been potentially exposed. And this is a major factor for places like South Korea and other countries that have really robust virus response programs. This has been a major factor in them improving their situation and decreasing their caseloads. So I think it's very hopeful that we'll be able to utilize that to keep our outbreak under control.
Great information, very helpful. A person had a follow-up question. I'm not sure if you know this answer or not, but somebody says, how does one become a contact tracer?
That is an excellent question. The state and the county are definitely going to be hiring many more contact trackers. I don't have a specific answer for how you get hired as one. I do know that the state is going to be reaching out. They are going to be opening positions. So, continue to check. Should I have any information specifically how to get one of those positions, I will pass it on to you, Leslie, so that you can pass it on to the community. But we're still working out the details for that. It is a work in progress, and it is going to happen.
Great, thank you. And that is a good reminder. If you people that are, for the folks that are on this town hall, if you're not signed up to get our email alerts, we have weekly email alerts that come up from the mayor. And this is the type of information that we share with the public when we get this new information out. So if you are not on this email distribution list, please email us at cityinfo@ssf.net, and we will go ahead and sign you up for this so that we can make sure that you get these timely updates. Another question for you, Dr. Sloan, is it's kind of a two-part question here. It says, I have a medical appointment for a procedure on June 16th. I have postponed it as long as I can. I need to take the bus. What can I do to be safe? Now, part of that is to let you know that I'm 80 years old. I called my primary care provider and asked her about my risk of COVID-19 infection. She said, given my excellent health with no underlying conditions, my risk was the same as adults. Could you comment on that?
Absolutely. So in terms of getting there on the bus and keeping yourself safe, make sure you sit away from other people, you wear a face covering, you maintain as much social distance as you can. Treat it just as you would going into, you know, a supermarket to pick up supplies. You want to stay at least 6 feet away from people. Make sure that the people around you are covering their cough. If somebody is not wearing a face mask, don't sit near them and try to, you know, potentially take the next bus. In terms of staying safe in your doctor's appointment, healthcare facilities actually now have probably become some of the safer places to be as we've learned more about the virus, more about protective equipment and been able to secure it. The procedure itself in going to the doctor's office should be fairly safe. You just need to make sure you use appropriate precautions on the bus. Now, in terms of your specific risks, pre-existing conditions are certainly a major factor in having a severe course. Age also does play a factor. You are definitely in a much better position than a 50-year-old with a lot of chronic medical problems, but probably in a much higher risk category than a 50-year-old without any medical problems. Now, that being said, I've seen people who are both young and old, healthy and unhealthy, develop severe courses of the disease or die. It's highly variable. Now, with that being said, I've also met people who are at the extremes of age who have had very mild courses. So it's hard to tell who's going to be a mild course and who's going to be a severe course. You're in better position than somebody with chronic medical problems, but you're in worse position than somebody who's younger. And unfortunately, there's not really a way around that.
Okay, thank you. Turn this back over to Mike for a couple of questions here. Another question has come in. When do you foresee gyms and fitness centers being able to open?
I think they will be, again, that crystal ball. Note that the city, we don't write the shelter in place. We can have some influence and we can pass on questions and comments to the county health officer. But the county health officer makes the decision. And by and large, the county health officers of the surrounding counties, San Francisco, Santa Clara, Alameda, et cetera, have gotten together and they try to be consistent, although there's some breaking apart there. But my personal prognosis or prediction is that gyms will be allowed to open soon, but with severe restrictions. So you may not be able to use the locker rooms at all. There'll be some restrictions on cleaning the equipment after use, maintaining social distancing. But I would see them opening maybe in the next 30 days, but they will definitely not be what they were in the past. Basically, you run in, use the machines, use the weights, someone from staff comes right behind you, cleans everything, and then you get out of there so you don't infect anybody. But you can see a day when soon they'll be open to some extent.
And another similar question came in. It says, when do the churches, when would they be allowed to have in-person services?
Great question that we dealt with earlier this week with one of our local pastors. The state order actually prohibits large gatherings, and that would include church services. And I don't see an end in sight for that. Probably one of the last things that will be open, and maybe even into 2021, will be large gatherings like football games or high school basketball games, and that would include churches. Now, there may be an amendment to say you can have a church service if you have 50 or fewer people, something like that. But the idea of going back to just unrestricted assemblages of people, I don't see that coming anytime soon. And again, it's based in the fact that if you get a large number of people together, the likelihood that one person in there would have COVID-19, it gets higher, and then you infect a large number of people all at once. So they're trying to avoid that at all costs. But that's being driven at the state level. And so once the state But you have to realize it's not just the county order, there's also the state of California order. So everything that we in the county do must be consistent with what Governor Newsom and his team have put out. So as the state relaxes, then the county can relax. And I do think assemblages of people like that, it'll be a long time coming, I think.
And this kind of dovetails into this, and with regards to the shelter in place. Somebody wrote in and said, I think I overheard the city manager say we would be under some sort of shelter in place for the remainder of the year. Can you clarify what was meant by we? Is that the county of San Mateo or the Bay Area? I thought it had only been extended through May 31st.
Great question. Thanks for the follow-up. So 2 parts. One, the original order, well, the order that came out 2 weeks ago did have an expiration date of May 31st. That is true. However, the latest order, the one that went effect Monday of this week, has no expiration date. It says this is in effect until the county health officer says otherwise. But it's not just us or the Bay Area. I think the entire state of California will be in some sort of a shelter in place for the rest of this year. So we is all of us. Now, I hope that by the end of the year, the shelter in place is really simple and says you can do anything you want as long as you wear a mask, have social distancing, and you cannot have assemblies of more than 100 people. And everything else is somewhat back to normal, maybe. But yes, you pretty well guarantee we're going to be under some health directive through the end of this year. It will be looser than it is now, unless there's a second wave. And you've heard about that on the news. Flu season is a real thing that'll come about near the end of the year. And if cases start to spike, well, then perhaps that shelter in place order will go the other way. But for now, there is no expiration date. And I think we should all get comfortable with the idea that we'll have some restrictions and what's allowed through the end of the year, but gradually getting easier and easier. And the last thing that will come off the shelter in place are large assemblages like, the San Francisco 49ers games and the Warriors and things like that.
Okay, thank you. And a couple questions for Dr. Sloan. Do we currently have reliable antibody testing in our county?
So that is an excellent question. And the answer is no. And it's not because we don't have it. So we have antibody testing. And the antibody testing so far that we have does seem to be reliable. The reason I say no is because we don't necessarily know what to do with antibody testing results. And we also don't know if the antibodies that we're testing for are truly antibodies caused by the COVID virus, or if they're antibodies caused by similar coronaviruses that cause the common cold. So there is antibody testing available. It's available commercially. It's available through places like Stanford and UCSF. There's also point of care tests that can be easily ordered by your primary care doctor. That being said, we don't know enough about these for them to be reliable enough to make decisions for. What we're using the antibody test for is essentially a surrogate to determine how much of a population has already been infected or exposed. We don't yet know if having antibodies means that you're immune to the virus, or even if you've potentially been infected by the virus, because some people may not mount an antibody response or may mount antibodies that are not the ones that we specifically test for. So at this time, these tests are very, very, very useful for studying the prevalence of the virus in the population, but less useful for the individual.
Okay, thank you. Another question for you. What are your thoughts with separate households having a dinner or meal together indoors? Of course, this would be fewer than 10 people.
This is a really hard question. And I'll put in essentially my own personal anecdote because I don't have a good answer. My wife and I are going to be expecting our first child soon. And of course, we want to be able to share that with our parents and our friends and family. The way that I'm going to approach it is that I'm not going to allow anyone into my home or around my wife or child unless they've been really aggressively social isolating for 2 weeks, really following their own precautions very well, and certainly no more than 10 people at once. I don't have a great answer for you in terms of whether or not you should do it at your home. I think a lot of it is your own personal risk tolerance. Obviously, the only way to stay truly safe is to avoid people. If you're someone who is high risk or works in a profession where you're exposing a lot of people around you, if you potentially get sick, or if you work with older people or people who are particularly vulnerable, I think it certainly is a possibility that it's something you should avoid doing. If you're doing small dinners with small groups of people in your home, being very cautious, that's up to you. As we start to, relax our social distancing guidelines, that's certainly going to be an option. I will let, my own parents into my home, but with very strict precautions and a lot of oversight. So I don't think I can give you a specific recommendation because I don't know your personal circumstances, but you really have to look at, not only the risk to you, but the risk to the people who are coming into your home and the risk to the people that you're potentially exposing. So make sure you look at it from all of the angles before you make a decision to really commingle with other people from other households.
Thank you for that. I think that's a good reminder for everybody. So another question for you. If not everyone elects to get the vaccine, how will we eradicate this virus?
That is certainly a difficult question. Public health emergencies like this only resolve when the public works together for a solution. Vaccines have been proven to be very, very, very safe, very, very, very effective. It's certainly something, not just for this vaccine, but for all vaccines, something that I strongly recommend everybody get. And they've, every vaccine that's on the market currently has been proven to be safe. This is a new vaccine. We don't have one yet, so we don't know the side effects yet. The reason we don't have one now, instantly, is because we don't know that they're safe. And part of the reason that it's taking us a while to make a vaccine is because we want to make sure that they're safe. So there's not going to be a vaccine until we have thoroughly tested all of the candidates to make sure we find the one that's the absolute safest for the population so that the most amount of people feel comfortable getting it. If we are in a situation where the majority of people, or even not necessarily majority, but even just a large amount of a minority of people elect to not get the vaccine, then unfortunately that measure won't help us in beating this virus, and this will be something that we'll have going forward. So our two options are essentially herd immunity, which is a lot of unnecessary death and suffering and economic damage as well, or a vaccination, which some people are uncomfortable with, and that's their choice. But without that really kind of society-wide buy-in, that answer might not work for us.
All right, thank you for that. Okay, couple questions for our city manager, Mike. One question came in that says about regarding the masks with valves. So many people are wearing these. How will the city and county let people know that they are not permitted?
Good question. I think it goes back to that educational component. So we need to be careful that when we're telling people wear a mask, that we also say, and here's the kind of mask we do not want you to wear. The masks with the valves, if they're the N95 masks, are in short supply. And those particular masks need to be reserved for your first responders like police and fire, and then for those in the healthcare profession who need absolutely that extra added element of safety. For us, for me, a cloth mask works fine. The simple surgical masks, those are in pretty prevalent, easy to get right now. So we will include that in our educational piece and educate people on what type of mask is not allowed and how to do that. But again, it goes back to penetrating people's psyche and their listening ear, that they actually see the message, hear the message, and heed the message. So we will keep trying to get that done.
Great, thank you. Another question for you is, what will happen if another outbreak occurs in the fall when schools open? Will schools have to shut down again?
I would assume so. I mean, worst case scenario is we have, people have described the recovery. Obviously, we're going down, but at some point we'll start going back up. Both the economy and everything. If you hit another rough spot health-wise, and then we start going down again, I think you can foresee that our health officials will take action. They said they will, and put another shelter-in-place order that closes schools and puts us all back sheltering in place at home until this is over. And this type of roller coaster may continue until there is a suitable vaccine or some of the testing that was mentioned gets better, because we just don't know yet where this is going to end up. So let's hope not. And the key to that not happening is what we've been discussing: maintain social distancing, remain the discipline of wearing a mask and washing your hands, and just being careful. It's only when we become complacent and we think that we're above it all and it's not going to happen to me, then bam, certainly it will. And then it will start to cascade. So take care of yourselves, take care of each other, and let's just hope that does not happen.
Great. Couple more questions for you, Mike. This one is a three-parter question or four-parter question is, this is questions regarding the small business relief loan. This person was in the first round of the lottery and they didn't get picked. They were wondering, one, why the lottery? So I'll go question by question. So let you answer that.
Sure. We did a lottery to make it easier and frankly more fair for our small businesses. Another loan program called San Mateo County Strong is a countywide program that's on a first come, first served basis. And we learned from their experience because they opened before we did. One, there was a gold rush of people, just crush of people at the beginning that crashed the servers. And then those businesses that were on top of it, they were linked in, they knew what they were doing. Those are the ones that got in there first and got the money. And the average small business that may not be as aware, they were left out. So instead, we opened a window and said between this date and this date, anybody can apply. Put your name in, take your time, do it right, don't stress. Here's the deadline. And we had 172 applications in the first round. And that's why we went the lottery. One, because we learned from the other experience that it was chaotic to do first come, first serve. But secondly, it is fairer to our small businesses and they're less stressful.
Thank you for that. A couple more to this question is, with regards to the lottery, is it transparent? Do we have public oversight? And what do you classify as a small business?
Sure. The lottery process itself was very transparent. It was actually televised and recorded. So you can go on our website. I think there's a link, Leslie, to that where you can actually watch the drawing. So we did take pains to make sure that it was as public as possible, and you can go back and look at it and see how it was conducted. What was the second part of that, Leslie?
What do you classify as a small business?
Oh, right. So it's any business that has, and this is on our website. So if I get it a little wrong, check it on the website. But a small business in South San Francisco that has a business license that has been in business in South San Francisco for 3 years or more and has gross annual revenues of 2.5 million or less. And that's the part you need to verify, the 2.5 million. But that's what's classified as a small business. So certainly the Genentechs and larger businesses in town, that was not where the council was aiming, or they were aiming at our restaurants and retailers and trying to craft a program that matches that. That definition we used, by the way, was the same used by the city of San Mateo and the city of San Francisco. when they were trying to do the same thing. How do we help our small businesses survive? Because they're the ones that probably don't have the deep pockets to make it very long.
And two more components of this question is how much financial support is given, and is it a loan, what rate, or financial support? Is there no payback, or what are the parameters?
Sure. So it's either a $10,000 or a $15,000 allotment, and here's the difference. If you have one employee who is low income, and that's defined for this county as making $90,000 or less. So if you have one employee only that's making $90,000 or less, then you're in the $10,000 category. If you have two employees that are making annually $90,000 or less, then you're in the $15,000 category. Initially, it is a loan, but if you keep your people on the payroll, then it becomes a grant. You do not have to pay it back. So that's very similar to the PPP program that the federal government has put out, where the federal government will give a business money, and if you keep your people on the payroll, you do not have to pay that back. So again, the details are on our website, ssf.net, but those are the amounts and how it works.
Thank you, Mike. And just to, again, when you go to ssf.net, you'll see right there on the home page a COVID-19 page. When you click on that, there is a specific tab called Business Recovery, and you can click on that tab, and all of that information Mike just stated is on the website. Okay, another question for you, Mike, is if Costco, Home Depot, and other mega stores can open their stores by having social distancing measures in place, why can't smaller retail stores be allowed to open their stores for customers to go inside if they were to maintain social distancing and have other safety measures in place within their stores?
Great question. Again, that's a decision by the county health officer. As I appreciate it in speaking with the county health officer, it's because Costco and Home Depot were originally classified as essential businesses. Costco because it sells food and people need food, and hardware stores in general were exempted right from the beginning because people may need repairs to their home if a toilet breaks or you have flooding in your home and you need those parts. So that is why those two were exempted. So if Grand Avenue Hardware, for example, has been open the whole time because that small business was exempted as a hardware store. If you're a dress shop, the feeling from the health officers was that is not an essential business. You don't need that in order to make it through the shelter in place. So that was the distinction. They looked at what does an individual need in order to successfully shelter in place at home and work from home. So Staples, which provides office supplies, has been open the entire time under the theory that, well, if you're working from home, you might need copy paper, pens, whatever. So we have to give you an outlet to make that happen. So that was the underlying theory from the health officer.
Okay, thank you. How about this one? Will summer day camp hold the usual numbers of people? And also, might the pool open sometime this summer for lap swim?
Great questions, both under debate right now. As I mentioned earlier, we can have summer camp and will, but we can only have groups of 12 kids. So we've surveyed the parents that we know about, and we believe we'll be able to handle all of those people who want to do summer camp, despite having to break into groups of 12. If it gets bigger, that may become a problem. However, the school system has told us if that becomes a problem, they will allow us to use some of their facilities to spread kids out into a larger area. So I think we'll be fine with summer camp. It will be different. There will not be a lot of sports activities. We'll do a lot of painting projects and sidewalk chalk and things like that, but it will still be entertaining and educational. We will not be doing field trips this summer because, again, that would put a bunch of kids together in a bus or somewhere. But we're going to make a go of it, partially because people are getting back to work, and they need to think about, okay, where is Johnny and Sally going to go during the summer if I go back to work? So we're trying to provide that to the community. On the issue of the pool, we are aiming to reopen the pool a little tiny bit by June the 15th. And I mentioned that sparingly. We'd like that to be part of the summer camp experience for those kids. It's something that we can do. And the county health officer does allow pools to open. However, severe restrictions. One of the restrictions is you can open the pool, but only people in the same family can be in the pool. One family at a time. Well, that's not going to work. There are some other rules, though, that may allow lap swimming. You can bet the lockers will be off limits. We would have to take reservations and then limit the number of people in the pool at one time. You stay in your swim lane. Once you're out, you leave the building immediately. We're working on those protocols. But I can foresee a day sometime in the future when we will get there. Doing it right, maintaining the health of our staff as well as our swimmers is job one. And the health officer is pretty strict about all of that. So we're working on the pool, but it will absolutely not be what it's been in the past. Take that out of your mind. Everybody believes the locker rooms, I don't know when the locker rooms will reopen, but there's probably a window where we can provide lap swimmers an opportunity in the near future.
And a follow-up question to that is, with summer camps and daycares opening, will the public health department inspect these facilities to ensure that they are complying with the health order?
So all of our programs are state certified, and there are health already pre-existing requirements and qualifications that go along with that. So it's really a very professionally run operation. But I don't know offhand whether the county will send someone down to inspect our programs. I do know that we've done it for decades. It's a super high quality program that is certified and award winning with people that have been doing it for decades. It's really the best I've ever seen. So we are taking the time, and that's why we're not even considering opening before June 15th, so we can write the correct protocols, have all of our supplies in place, have all of our people trained, so that June 15th, when we open the summer camp, when we bring the pre-K programs back online, we are ensuring as best as we can that our kids are safe and that our staff is safe.
Okay, I've got two more questions. I do want to respect people's time tonight. I do want to I'll remind you real quick, if you do have a last minute question, you can text 650-636-6668, or you can use your chat function. We'll get your last minute questions. If not, we can always follow up after this town hall. But the last two questions I have for now is one for Mike and one for Dr. Sloan. Mike, and I'm not sure if you'll have the answer to this one, so I'm going to kind of put you on the spot a little bit, but it says, I have an appointment next week for the Real ID at the San Mateo DMV office. Is the DMV open?
Boy, that's a great question for Assembly Member Kevin Mullen. What I understand is that the DMV is open, but only the San Francisco office. But that information is a week old, and that was gained during a conference call with the county manager. What I would do is just go to the DMV website. I'm sure it's all there, but I don't believe the facility in Daly City is open. Then I know the one in San Francisco is. So I would just check the website.
And I would add to that, I do believe I heard that the extension for getting the Real ID has been extended, or the deadline has been extended. But again, Mike brings up the point, just go to the website and hopefully you can get all your information there. And another question I have, and this is for Dr. Sloan, and that is, do we have any multi-inflammatory syndrome cases in the Bay Area? And if so, does it appear to be increasing?
So I don't have specific numbers for that. I do believe we have them in the Bay Area. I don't know at what specific hospital or how many at this point. However, I have heard from many of my colleagues who are pediatricians, especially those in areas that were very hard hit by the virus, that there may be some delay in having these patients present. It's not really a direct result of an active infection of the virus. It's something that happens later. So we may see those numbers increase. If we have any here, and unfortunately I don't have the numbers in front of me, if we have any here so far, it's a relatively small number, but we're going to keep our eyes out to see how aggressively that number is going to change. The reason that we do know that this is something that is related to the COVID virus is that in other places that are having a major uptick in these cases, many of these children are testing positive either for antibodies to the COVID virus or for active infection, or have had a past documented infection. So there has been a significant increase in these cases, and that's been seen not only just in places like New York City, as well as in places of California that have been more hard hit, but across the world. So I do expect that we will have an increase in those cases here, just as this pandemic progresses, and as the amount of time between the initial infection of the child to the point where they actually develop the inflammatory syndrome.
Okay, great, thank you. Well, I'll tell you what, we have not had any more questions come in. I have a couple last minute reminders and some updates, and also I'm going to turn this over to Mike shortly to end this. But one thing I did get on our chat, and I believe perhaps the CEO of the Boys and Girls Club of Northern San Mateo is on this town hall, and he wanted me to remind everyone that the Boys and Girls Clubs of North San Mateo County is offering all-day child care services for essential workers, and that we do expect that definition of essential to expand as the shelter-in-place restrictions lighten. The services do take place at their Orange Park Clubhouse, which is located at 201 West Orange Avenue. So please reach out to the Boys and Girls Club of North San Mateo County if you're interested in that all-day child care. And then just in terms of just the closure here, is I just want to remind folks that all the questions that were asked tonight we will post on our website. Again, that is ssf.net/coronavirus. Really encourage you, if you're not signed up for our email updates, that we get a weekly update from the mayor, and all the new information that comes is put into those emails. So send us an email, cityinfo@ssf.net, and we'll get you on that email list. And then I am going to put a plug out there for the census. The deadline to respond has been extended, and that is now October 31st. So please go online. It doesn't take long. It's my2020census.gov, and go online and fill out the census. So before we end this meeting, I'm going to turn this back over to our city manager for some closing thoughts. Mike?
Thank you, Leslie, and thank you all for attending. Great questions. Please continue to look at our website, and we push out email information as much as we can. We are all in this together. If there is a silver lining to this entire pandemic, it has been the spirit of community that has been shown in South San Francisco. Volunteering, helping each other, remaining as cheerful as possible, and helping each other stay safe. So thank you for that. And let's not forget that we are headed into Memorial Day, and that is much more than just another day sheltering in place or barbecue, but it is a time to remember those that have fallen in defense of this country, so that we can have the freedoms that we enjoy. So take a moment on Memorial Day to remember those, both in the armed forces and not, that have given their lives for this country. An interesting note, the California National Guard will do a flyover of South San Francisco at 1 p.m. on Monday. So look for that. There'll be fighter jets flying over the city as a salute to Memorial Day, and just take a moment for that. In the meantime, stay well. Please follow the advice. And if you need help, call us. That's what we're here for. We are helping people every day. Call us, email us. If we can't help you, we will find someone who can, because we're all in this together in one community and one fight. Thank you.